Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Lucy Abbot, QLife National Project Manager at the National LGBTI Health Alliance. She joins us today to talk about her organization and the wonderful work that she does there. Without further ado, welcome to the show, Lucy. It's so nice to have you here.
Thank you very much for inviting me. Great to be on the show.
So, Lucy, please tell the audience more about yourself and the nature of your work.
Okay, well, I've just recently started at the National LGBTI Health Alliance, managing QLife. So QLife is the national telephone, this is an Australian service, QLife is the national telephone web counselling and referral service for lesbian, gay, bisexual, transgender and intersex communities. We're an anonymous service provided by and for the LGBTI communities and their allies. And the QLife service operates from 3 p.m. to midnight every day of the year on a 1-800 number. The calls are free. And we also operate web chat through the website too.
Wow, this is very interesting. So can you tell us, how did your organization start?
Well, QLife is just 5 years old. We're very young, but what's unique about QLife is that it's delivered by 5 partner organisations across Australia with a shared history of passion and commitment for our communities. So the National LGBTI Health Alliance hosts the national QLife team from our Newtown offices, and we support the organisations that actually provide the telephone and web chat services. So those services are delivered in Victoria by Switchboard, in New South Wales by 2010, which incorporates the gay and lesbian counselling service. In Queensland, it's provided by Diverse Voices, and in WA by Living Proud. So together, our 5 organisations have got over 150 years' experience in delivering counselling and support to our communities. And yeah, it's got a great history, and the national team here in Sydney, we coordinate kind of volunteers and outreach in states that we don't have a partner organisation, so that we make sure that we get the national awareness and coverage.
I see. So how many people benefit from this QLife project of yours?
That's an interesting question. It's very hard to it's hard to really quantify that because what's very unique about our service is that we're anonymous. So we don't collect, we don't have the names and contact details of anyone who calls us. So we do get repeat callers, but we don't have any way to monitor that because of our anonymity, which is a very particular feature of our service, and for our communities it offers a level of safety and security in their calls. So it's a little bit hard for us to measure that.
That's okay, no problem. I totally understand. That's the wonderful thing about your service is because of your anonymity, people are able to call about their concerns and remain anonymous, because that's been the concern for many years regarding these types of services.
That's right, correct, yes. And I wanted to perhaps just to point out that we're not a crisis service. We're early intervention service. Because we don't operate 24 hours, we can't provide crisis response. So we're an early intervention, and so we provide lots of resources as well on our website for health professionals. We've got guides on coming out, bisexuality, rural and regional issues. So health professionals call on these guides quite a lot, and we also have a whole series of lived experience videos available on YouTube. So the health professionals kind of really value those resources after the community.
Yes, and speaking of health professionals, how is the QLife Project relevant to health professionals?
I would say it's hugely relevant to health professionals. It provides as a referring agency. So if you have lesbian, gay, bisexual, transgender, or intersex people who are wanting support, you can refer them to our telephone or web chat service, and I'll give the number later. They can also access our resources and guides on the website, which is qlife.org.au. Lots of the health professionals, we present a lot at conferences across Australia. Our feedback at conferences is health professionals really value this service because we're a peer-driven service, but we also provide counselling, so we've got that duality happening that the practitioners really value being able to refer to us.
That's wonderful to know. Now, Lucy, if you don't mind, can I ask you a personal question?
You can.
Thanks. Actually, I ask this to all of my guests that come on the show. So can you tell us, Lucy, why are you so passionate about the QLife Project?
I'm passionate about it because I'm working with my own community. I'm in my 50s. I spent many years working with other communities and in mainstream services. And as a lesbian, to be able to work in my own community has an extra layer of meaning and significance. And as a more mature person, I can see the value of QLife for people who are going through different stages of their journey in life, whether it's about coming out, whether it's about questioning your gender or your body, whether you're looking for support and services. QLife offers so much, and it's got such great integrity as a service, with being peer-driven and the partnership that gives us kind of local expertise. I love everything about it.
Yes, that's where it all starts, Lucy, is love. Love conquers all.
That's right, it does.
I love that phrase. Anyways, Lucy, I would love to chat with you more, but we're running out of time. But before we go, Lucy, what is your main takeaway message to all of our listeners out there?
I would say call QLife if you have any questions. We have staff and volunteers available on the phones from 3 p.m. to midnight. All of our volunteers and staff are part of the community. Our services have grown alongside our communities, and they reflect our communities. And we understand what makes people strong and what can help people when we're struggling. So I would say call us. Our number is 1-800-184-527. Or you can log into the website qlife.org.au for a web chat session, knowing that you'll be able to speak to one of your community.
That was a fantastic message. Thank you so much, Lucy, for coming on the show.
Thank you.
And that was Lucy Abbot, QLife National Project Manager at National LGBTI Health Alliance. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and this is Health Professional Radio.